Welcome to today's episode of Trauma Demystified. My name is Natalie Jovanich and I'm your host on this journey. Today is all about parts work therapy and how it can help you heal from trauma. Before I get into the content, I apologize for this episode coming out very late. I have been invited as a guest to some other trauma-related podcast and I just did not have the time to finish it in time. So I've attached the links to the other podcasts below if you want to explore them further. I'm very excited to share more about parts work today. Parts work has been an essential part of my healing journey from childhood abuse and systemic violence. I'm passionate about parts work therapy and practice the inner dialogue with my parts nearly daily. Additionally, I've seen a profound transformation in working with my clients when we apply parts work in therapy. So this episode gives you an overview about parts work, why it matters for trauma recovery, and how it can be used in treatment or self-healing. So start with an introduction. What is parts work therapy? First, there are different therapeutic approaches that work with parts. The most popular one right now is internally family system therapy, also called IFS, which is developed by Dr. Richard Schwartz. However, parts work therapy isn't uniquely associated with IFS. Dr. Janina Fisher has developed her specific methodology to work with parts in the context of trauma, and other contexts include inner child work and also inner bonding. In my healing journey, I started with parts work quite early, and it was far more effective than psychotherapy. Later on, I went through a 2.5 years training of systemic constellations and different coaching trainings. All of them included different aspects on parts work in their curriculum. Since they were experiential professional development courses, they also gave me the space to connect more deeply with my own parts. Later on, when I trained as a counselor, Gestalt therapy resonated with me since its concepts resonate with parts work therapy. So many therapeutic approaches involve the concept that humans have different parts. While I find Freud's perspective often pathologizing and deterministic, and I'm not a big fan of him, he had an idea about different parts and labeled them ego, superego, and it. Carl Jung has a different take on parts work and saw them as parts of the collective unconscious. He referred to parts as archetypal personalities seen in myth and legends. He developed 12 different archetypes: the innocent, the orphan, the hero, the caregiver, the explorer, the rebel, the lover, the creator, the jester, the sage, the magician, and the ruler. Furthermore, many attribute the origin of inner child work to Carl Jung, since he has created the child archetype. So overall, parts work therapy has been part of many different therapeutic approaches and has evolved over the last decades. So let's see how it can help us connect with ourselves more deeply and really heal from trauma. So what are parts in parts work therapy? Before I look more deeply into the context of trauma, I want to emphasize that every individual has different parts. Parts can consist of different aspects. So in parts work therapy, emotions are seen as parts. I don't know about you, but my emotional landscape is often more diverse than just one feeling. One part of me can feel sad, while the other part of me can feel frustrated or annoyed. In this approach, we see our emotions as parts of us and not all of us. This shift in language allows us to express the complexity and diversity in our inner world. Furthermore, parts can also be certain roles that we have taken on in our lives. There can be parts that are caregivers, peacemakers, or fierce warriors to protect us. Sometimes these parts stem from the roles that we have taken on due to the family dynamics in our childhood, and sometimes they can be influenced by social roles. Some people experience parts dependent on their ages. For example, I worked very intensely with my 3-year-old part that carried the wounds of sexual abuse. Parts can have different ages. Some refer to them as adult me and little me, and so this really depends on how you experience them. Please note that some people don't resonate with the concept of ages in their recovery, and that's okay. There's really no right or wrong way to get started with parts work and to label your parts and experience them, because we all will have our own way on how we see parts and how we experience them. Other people can also see parts and give them other descriptions, like our creative part, which is very important for trauma recovery, and also the wise part, which holds the wisdom and lessons learned from what has happened to us. Additionally, some people may have a strong part or a part that tends to procrastinate. So in a way, it's really about finding a creative way to express our inner world. For some people, it's useful to find other descriptors to describe their parts. And so I found it very helpful to use animals and really ask people like what animal could represent this part. Because also animals may help us if parts have a negative connotation to create a more compassionate relationship with them. So for me personally, I really like to use different animals. And some other people really like to use colors or certain objects. So it can be I have a yellow part, or I have a cloud part, or there is a dark hole part. So it's really depending on our creativity and our experience what resonates with us. So while parts work can be beneficial for everyone, I find it incredibly impactful for people who have experienced category 2 and 3 trauma. Here are some brief indicators on how to identify it. If people have experienced category 2 and 3 trauma, it is more likely that the individual has experienced several traumatic experiences due to enduring conditions. This can mean that they have developmental or relational trauma. This type of trauma can be related to adverse childhood experiences, abusive relationships, situations of domestic violence or systemic violence. Additionally, the nervous system has various degrees of dysregulation. So I've talked about this in the episode Smart Goals for Trauma Recovery. So please feel free to check out this episode if you want to dig deeper into this topic. So why does parts work matter for trauma recovery? In a professional development course, Dr. Janina Fisher introduced me to the theory of structural dissociations. She offers fantastic workshops on working with trauma, which I highly recommend if any one of you is interested. The theory of structural dissociation gives a context of how being exposed to chronic traumatizing environments can lead to fragmented parts. Thus, it also explains why parts work is beneficial. Please note that I only talk about parts that carry traumatic wounds in this context. Generally, we have different parts. Some don't carry traumatic wounds. Structural dissociations explain how our brain uses the split between the right and the left parts to survive chronic trauma. While we are born with the right and left parts of our brain, the right brain is usually more dominant in our childhood. The left part matures only slowly when we grow older. Initially, there is no communication between the two parts of our brain. The connection between our brain parts, the corpus callosum, develops slowly throughout childhood. It reaches its final maturities when we are in our early 20s. And as a result, our brain uses a natural split to allow us to survive trauma and extreme conditions. To explain it in a simplified way, if we go through a traumatic experience, our brain splits into the two parts. The carry-on parts connected with the left brain, and the emotional parts that hold the traumatic wounds associated with the right brain part. Please note that these parts have been different labels depending on the literature. So let's look a little bit closer to the different parts. The carry-on parts. They tend to go on with our normal daily lives, whether it's functioning in our jobs or our relationship. The carry-on parts usually try to minimize what has happened to us. A carry-on part may tell us that it was not so bad, and it has a motivation to protect us from overwhelming emotions. Since these parts are well adapted, they are usually seen as more positive than the emotional part that carry the wounds of past trauma. However, the carry-on parts are interrupted when the emotional parts get activated. The emotional parts carry the memories of the traumatic experiences and the associated emotions. The parts hold the traumatic experience, and they may result in hypervigilant, mistrust, overwhelming emotions, debilitating anxiety or depression, or self-destructive behaviors. We usually hide these parts behind an invisible wall to protect ourselves. And so when we are in a similar experience, these parts get activated because they want to be integrated. And so we often experience them as emotions and not as parts. And a sign that an emotional part is activated is that you are in a situation and the emotional intensity is far higher than you would expect to have it in this situation. So what is important to know about structural dissociations? As with any traumatic experience, each individual has a unique inner response system when it comes to structural dissociations. Therefore, some fragmented parts will resonate with you while others will not, and that is perfectly fine. Structural dissociations are an adaptive coping mechanism and are a brilliant protective mechanism that allows us to survive traumatic situations. Structural dissociations range from very subtle to more rigid and traumatic. Additionally, the concept of structural dissociations matches the symptoms of borderline personality disorder, complex PTSD, and dissociative identity disorder. Since these mental health diagnoses are often stigmatized, it is usually really validating for some of my clients when they understand structural dissociations and can connect their diagnosis and their symptoms with past trauma that happened to them. In my case, I read a memoir which is called First Person Plural, My Life as a Multiple by Cameron West when I was a young adult. He described his journey to get to know his different alters and living with dissociative identity disorder. While I don't have DID, his way of explaining his different alters and their behaviors resonated with my inner experience of fragmentation. It was the first time that I read about somebody who, for example, used self-injury. And while our experience really are different, his memoir helped me understand myself better and to not feel alone. Also, his story really gave me hope that recovery was possible. So let's look at the different parts that are associated with structural dissociations. These parts are often disliked or stigmatized or pathologized. Therefore, it can be really hard to look at them, and some parts may want to avoid to look at them. However, these parts usually have a protective function that helped us survive in incredibly difficult situations. They may feel stuck in this past experience and have behaviors in the current moment that aren't helpful. For example, during my childhood trauma, I developed a strong fawn part that let go of all of my boundaries. While it protected me from physical violence in my childhood and it really de-escalated emotional abuse, it wasn't helpful anymore in my adult relationships. Therefore, it is essential to separate the part's motivation from its behavior. Additionally, the parts are not the wounds they carry. And furthermore, parts that hold the trauma wounds can become beneficial and supportive once the trauma wound is healed. So the first part associated with structural dissociations is the fight part. It can be seen as a fierce protector, emerging to defend the individual against perceived threats. It can be hypervigilant and ready to respond aggressively to danger to ensure safety. An unhealed fight part is often impulsive and tends to be aggressive. The flight part wants to ensure safety through escape and avoidance. Therefore, it can show up as being distant or strongly ambivalent. Sometimes it wants to protect us from our overwhelming trauma-related emotions by addictive behavior or disordered eating. Sometimes it can manifest as escape fantasies where people try to daydream from a safe and idealized place. An immobilization response to a perceived threat characterizes the freeze part. It is related to the dorsal vagus response of our autonomic nervous system. Freeze can often feel contradictory. We may experience a high level of inner anxiety, and we are unable to move or speak. We may experience a sense of feeling terrified or have a panic attack, and we can't move. Freeze is often the first step into dorsal vagus activation, while fawn is the full dorsal vagus shutdown, which directly leads me to the fawn part. The fawn part can carry shame and can have strong feelings of hopelessness and helplessness. It can be filled with self-hatred. The fawn response is the opposite of the fight response. It is extremely passive. The fawn part, sometimes also called the please and appease part, often lets go of all our boundaries to survive. Fawn parts can have people-pleasing behaviors and lead to codependency in relationships. And our fawn parts also tends to self-sacrifice. And the final part is the attached part. This part sends out a cry for help. It often feels lonely and abandoned. It can experience an intense need for connection, mirroring the despair of a small child. It may beg for not being abandoned. It often intensely longs for connection and rescue. It is usually very sweet and innocent, and it has a desire to depend on others. While these are the wounded aspects of these parts, I also want to give you some ideas on how they can support us when they are healed. And since everyone is different, the positive aspect of these parts will look different for each one of us. So just to give you some ideas. A healed flight part can become a vital resource to assert our boundaries and build confidence. A healed flight part is grounded and can assess risk realistically. It can support us in proactively taking care of our safety and creating balance in our lives. A healed freeze part can motivate us to be flexible in our responses and mindful of our limits when we engage with life. A healed fawn part can balance self-compassion and compassion for others. It understands our needs and knows our limits. It cares for others, but it really respects also our own boundaries. A healed attached part understands the balance between autonomy and independence. It helps us create mutually beneficial relationships. It relies less on external validation but can internally validate us and increase our self-esteem and self-worth. It can help balance healthy boundaries in relationships together with the fight or the flight part. So here is just an idea to understand that yes, when the parts have not yet been healed, they have behaviors that aren't healthy, but over time they really transform and they become more supportive for our lives. Please note that parts can activate each other and create emotional turmoil inside of us. So sometimes it can really feel as if we are spiraling, especially if there's a lot of different parts talking at the same time. So as a takeaway, the fight, flight, freeze, fawn, and attach part develop through structural dissociations. We may experience all of them or only some of them, or maybe they are different depending on the context we are in. The first step of trauma recovery is to create awareness when these parts are activated and find strategies to manage them. So how can we begin with parts work therapy? So parts work therapy can be used in many different ways for trauma recovery. I find it useful throughout all 3 stages of trauma recovery, whether it's a stabilization and safety stage, memory integration and mourning, or reconnection. In general, I think the concept of parts work allows us to create more fulfillment and well-being at any stage of trauma recovery. So in the first stage of trauma recovery, the main focus is stabilization and safety. Parts work usually focus on creating awareness about parts and finding strategies to soothe activated parts. So here are some examples on how I use it when I work with my clients. So first of all, in my collaboration with my clients, I usually provide psychoeducation about the theory of structural dissociations and how we develop parts very early on in our collaboration. I have noticed that it really helps clients to normalize their experience, and it also helps them to reconnect with their adult self and to activate their prefrontal cortex. Because when we are on a trauma response, our prefrontal cortex often gets disconnected, so we cannot connect with it. The next step is to really learn how to discern between the adult self and the different parts. So to effectively apply parts work, we must learn to separate parts from the adult self. And sometimes we can feel very fused with our part, and it can really take some time to separate them from the adult self. And so mindful awareness is really an essential skill that supports in this process. The next step is really to learn to speak parts language. In this process, an individual learns to use parts language to express complex inner dynamics. So it means to say, a part of me feels angry instead of saying I feel angry, or a part of me feels ashamed. And so I usually use this language when I connect with my clients and when I reflect back to them what I hear. And I also facilitate conversations between the clients and their parts. So in this process, I just invite my clients to connect with their parts, and there are different ways to do it. You can either do it internally, you can externalize the part, or you can do a visualization. And then it's really about what is the individual curious to learn about the part and what is going on in the relationship. So how the conversation goes depends on the context. So overall, parts work also gives us more compassion and empathy towards our parts, because it allows us to create a connection with them and they don't feel these overwhelming emotions. Furthermore, in this phase, clients learn to identify their activated parts, and we find strategies to navigate them to get back into the window of tolerance. Additionally, there's really also this exploration of whether the danger is present in the present moment, or whether it is triggered by past experiences, or whether it's both. So what do I mean by that? So sometimes, for example, a flight part might get activated in a relationship. And yes, to some degree, it can be because of a past experience of abuse. However, it also means that in the present, we need to look at the relationship. What are the dynamics in the relationships? What are maybe boundary violations in this relationship? So it's really to assess the situation, assessing what's going on. Another way how we can work with parts is really that we put these parts into a safe place so that they don't need to go into every situation. So people can visualize a safe place for the parts before they have a difficult conversation with their manager, for example. And so another thing which is part of parts work therapy is really creating relationships with these parts. And so it is about understanding their needs and their boundaries. And it's also about connecting with them and validating their experience. And so this may also depend because sometimes we don't like the parts we are seeing. So we need to kind of work through our own emotions so that we can create a healthy relationship with the part. And so this process really depends on the client's process. However, it really helps the client also to create more inner calm and be more connected with them. And it helps them to externalize their inner processes and also work through their inner conflicts. If you have experienced trauma, we usually have quite conflicting parts. Like when I first started my work, some of my parts didn't even want to be in the same room. But expressing this distance was really helpful for my own recovery and also giving the parts the space and the time until they are ready to be together in one room. After this brief overview about how to get started with parts work, here are some of the applications where I often use parts work with my clients. So as I said before, I find parts work extremely valuable if an individual has experienced trauma due to enduring conditions. And I usually use different best practices for trauma recovery, and I integrate parts work with the EMDR. Furthermore, parts work can be really helpful if we work through other trauma-related symptoms like anxiety or depression. It can also help us work through insecure, disorganized attachment styles, and it allows us to regulate our nervous system. Furthermore, parts work can be really essential for us to create healthy boundaries in relationships. Because when we have experienced trauma, there are sometimes parts activated if you want to set a healthy boundary. So it's usually not so easy to start connecting with boundaries and start setting them. And we need to find strategies to work with the activated parts prior to setting a boundary. One thing which is really important to note is that the goal of parts work therapy is not to get rid of parts. It is about fostering a healthy connection between the adult self and the different parts. However, it's often not as easy as it sounds. Sometimes parts are hidden behind the wall or they are really excluded from our inner system. We can reconnect with these parts and give them a voice through parts work therapy. So this includes, for example, reconnecting with these parts which have been hidden behind the wall or these parts which we excluded from the system because they had really inappropriate behavior from our point of view. This aspect of parts work therapy is a bit like the Japanese art of kintsugi, which rejoins broken pieces of pottery by mending them with gold. The new piece of pottery is more exquisite than before the break. So when trauma comes into play, it may feel as if there are many fragmented pieces. Still, we can choose to rejoin them and create a beautiful, more precious piece of pottery. Each piece contributes to its value, whether it's the pieces that were broken or the often time-consuming process to put them back together or the process of mending them with gold. Each of these little steps are an important element to create the final work of art. And so this is a bit how I see parts work therapy. When we are connected with our parts, we are this beautiful new piece of art where the broken pieces are surrounded by gold and we are set together and we experience wholeness. Furthermore, parts work therapy can foster inner harmony and calmness. For example, if my parts want to talk to me, I often experience inner trauma like there is a really stormy sea inside of me. And so if I check in with them and the different parts feel validated, acknowledged, and understood, there's suddenly a sense of inner calm. And I have a similar experience when I work with my clients. If you have understood the different parts, usually my clients have a sense of calmness and they feel resolution and they know what is the next step. Another thing around it, it really helps us to work through inner conflict because many decisions in life aren't that straightforward and there are conflicting parts that have different ideas. And so it's really about how can we understand them and how can we negotiate a solution with them. Another goal of parts work therapy is to help individuals achieve emotional balance. This includes working with more extreme and reactive parts, finding strategies to soothe them, and fostering a more stable and centered state of being. It also means supporting individuals in embodying a strong sense of their adult self so that they can really hold their parts with curiosity and compassion. And then in the second stage of trauma recovery, the wounds of the traumatized parts become healed and the parts can transform their more extreme roles. So as a takeaway, the goals of parts work therapy and trauma recovery are aligned with the goals of trauma recovery in general. Working with our parts is an inner process that includes strengthening the adult self and reconnecting with our parts. Curiosity and patience are vital ingredients for this parts work process. The more we can be in healthy connections with all of our parts, the more we can be empowered and feel in charge of our lives. So now, how do we apply parts work for our own self-healing? So first of all, I don't know you, so I'm not fully sure what is going on in your life. So I want to invite you to have patience with the process and also start where it's easy. But if you're curious to try it out, here's some simple, easy exercises where you can start it. So the first step of parts work therapy is really to see your different emotions or your different behavior patterns and body sensations as parts of you and just start to recognize them. So how can you do it? You can just start exploring your inner system by journaling and self-reflection. So think about a situation that happened today and ask yourself, what were the different sides of you that came out in this situation? How do these different parts feel like? And maybe you can ask yourself, how do the different parts relate with each other and what are their roles? Because it is common that one part shows up and then another part shows up. Like there are some parts that try to save you and there are some parts that may have a really bad relationship with the other part. And that is okay. So your role is to be curious about them and to really explore your inner world from your part's perspective. And if you have a better understanding about the different parts, you can explore a specific relationship with one part. So first of all, identify a part you want to explore a little bit better. Then try to connect with your adult self as good as you can and really lean into curiosity. I would say really start with parts that are easy. So for example, if you have a very joyful part, you can start a conversation with the joyful part first. So the first step is that you notice a part in your body. Really connect with the moment when the part was present, notice the body sensations, the feelings and thoughts. So the next step is you can try to externalize the part outside of you. So for example, you can either visualize that you sit it in front of you somewhere, either on your desk or maybe you have a chair. And the other thing is what you can do, you can, for example, take a pillow and put the pillow somewhere and the pillow represents the part. And then go back to your seat and just be curious about the part and just notice how big is it, how small is it, how does it look like, what is its shape, what is its color, and really make it tangible for you. And then again, reconnect with your adult self as good as you can. And you can do this by taking some breath and noticing your feet on the ground. And then lean into curiosity and ask yourself, what are you curious to learn about the part? So for example, you can ask the part, how old is it? Or you can ask the part what it wants to tell you. You can ask the part what it wants to eat for lunch. You can also ask the parts more deeper question. So really start where you're at and start with what you feel comfortable with. And then try to tune into the part and just see what it answers. And if it tells you something, just validate it and give it empathy and really acknowledge what it has said. You can also work with parts and explore with them what their boundaries are. You can explore with the parts what their needs are. And so while it can feel weird in the beginning, I usually say to my clients, it's just like a conversation with a good friend. Like if this part and what it said to you, if it were your best friend, what would you reply? And so really start this conversation and connect more deeply with the different parts. So while I touched on navigating activated parts, I also want to give you a tool how you can work with them So there are many different ways on how we can work with activated parts. And you can also check out the episode about the window of tolerance, where I give you some tools to reconnect with your window of tolerance. But like one way how you can do it is if you notice that there is a part activated within you, you can really connect with your spine. So what you can do is put your feet on the ground and really connect with your spine. And really notice your spine from the tailbone up, and really notice sensations in your spine. And if you can, you may just try to lengthen your spine from the tailbone up and really allow yourself to feel your spine. And I often say to my clients, if we connect with our spine, we connect with our dignity. So really allow yourself to feel your dignity. And then come back and really check in what has shifted with the activated part. How is the sensations? Are they better? Are they worse? And really notice how this exercise impacts you. So these are just some small examples on how you can work with parts. I would invite you, whenever you feel overwhelmed or you notice your nervous system becomes dysregulated, take a break and ground yourself before continuing. For many reasons, it can be hard to connect with parts in the beginning. It may also be difficult to connect with the concept. Feel free to seek professional support if connecting with your parts feels challenging or if the emotional intensity becomes too much. You are not alone on this journey, and really trauma recovery looks different for everyone. And it's usually a sign of strength to ask for help. It's okay if you say you don't want to do it alone. So overall, patchwork therapy helps individuals identify and understand the different parts of their personality that have emerged in response to trauma. Fostering internal communication and acceptance reduces inner conflict and promotes a more cohesive sense of self. Patchwork therapy is especially useful for people who have experienced trauma, and this is explained by the theory of structural dissociations. Ultimately, this therapeutic approach aids in integrating the parts. It leads to a better emotional balance and more harmony inside of us. Furthermore, patchwork therapy strengthens the core identity and facilitates the healing of trauma and enhances our overall well-being. So thank you today for listening to me, and I really hope you enjoyed this episode. Remember to subscribe to Trauma Demystified to stay up to date with new episodes. I hope I see you next time, and I hope you have a beautiful day. Take care. Bye.